Hello and welcome to the initial podcast of The Calm in the Chair, the Dental Fear Solution. I am your host, Dr. Vincent Monticciolo, the founder and CEO of Monticciolo Family and Sedation Dentistry, Florida's largest IV dental sedation provider. As a brief introduction and background, I've been practicing for 34 years. Of that, probably 25 years in sedation. And I continue to practice IV dental sedation daily. I've actually limited my practice to just seeing this demographic of patients. I truly enjoy and have a passion for treating this select dental demographic. And hopefully, as we get to know each other, I can answer your questions and relieve some of your fears regarding dental sedation. Today, we will touch base on the basics and kind of set the table for future episodes. The agenda for today, we'll define dental sedation. We'll talk about the different types and levels of sedation, the advantages and disadvantages of each, and who can benefit from these services. So let's get started by defining dental sedation. Dental sedation refers to the use of medication to help patients relax during dental procedures. It's commonly used to ease anxiety, reduce discomfort, and help patients who may have a fear of the dentist or a low pain tolerance. Depending on the type and level of sedation, patients can be fully awake, drowsy, or completely unconscious. So let's get into the different levels of sedation, starting at the least. So minimal sedation is where the patient is awake but relaxed. Moderate sedation, also known as conscious sedation, the patient will not remember most of the procedure. However, the patient is easily arousable. And then we'll get into the further levels of deep sedation and general anesthesia. So this is kind of a continuum from moderate to deep sedation where the patient is on the edge of consciousness into general anesthesia where the patient is completely unconscious. Each of these levels requires a different level of training, different level of office certification and doctor certification, and different level of monitoring and equipment. So here are the main types of sedation being used in the dental offices now. So number one would be nitrous oxide. Most patients have or remember having nitrous oxide, especially it's used quite a bit in pedo offices. We have it in our office. A lot of dentists have nitrous oxide. It's a mild form of sedation. It's inhaled through a mask. It helps patients relax but keeps them awake. The effects wear off quickly, allowing patients to drive home after the procedure. The advantages or pros of nitrous oxide dental sedation would be quick onset and quick recovery. So nitrous oxide takes effect within minutes and wears off very quickly after you turn off the nitrous and just put the patient on direct oxygen. Patients are able to drive home and resume normal activities soon after. Nitrous has minimal side effects, the most common being nausea, maybe headache. If they've had excessive use of nitrous, there is some vomiting involved, especially in children, or if the level's pretty high. The dentist is allowed to adjust the level of sedation, but the patient will always be conscious and awake. Another probably biggest advantage is there's no needles. So unlike IV sedation or general anesthesia, nitrous oxide is inhaled through the mask, making it a non-invasive option for patients who fear needles. Another advantage is obviously they stay conscious and it's suitable for many procedures. The disadvantages or cons of nitrous oxide is it's not effective for moderate or severe anxiety. In our offices, this wouldn't affect any of the patients that we really treat. We can or may use it just to relax the patient while we place an IV. But other than that, this isn't going to take the effects that IV dental sedation will be able to do. It offers, like I said, a mild relaxation. It's great sometimes for hygiene for patients. They could have sensitive teeth. It doesn't relieve any pain, but it kind of soothes things down. So it has a limited anxiety reduction. The next method of sedation that's used in the dental offices would be oral sedation. This involves taking a pill, typically an anti-anxiety medication, such as Valium or Halcyon. The level of sedation can range, from mild to moderate, depending on the dose. Patients remain awake, but feel very relaxed, and some may become drowsy. The advantages of oral sedation, once again, is easy administration. It's simple to administer. Patients take a pill prior to their appointment. If they take it at home, then someone needs to drive them. If they take it at the office, someone will need to drive them home, making it's very non-invasive and needle-free. It's effective, for mild to light, maybe moderate sedation. It works well for patients. It helps them feel calm, relaxed during their dental procedures. It has a relatively long-lasting relaxation effect. There will be some partial amnesic effect, which can be helpful for those with the dental phobia. And it does have customizable dosing depending on what the dentist prescribes. So some of the cons or disadvantages of oral sedation is a slower onset. So giving this in the pill form could take 45 minutes to an hour to see the effect, and the effect might not be enough for a patient to be relaxed enough to have dental treatment. You can't adjust the dosage over the recommended dose. So the Florida law states that dentists are only allowed to give up to the maximum amount of that medication for a patient. So they can add nitrous to help the relaxation. However, if they're giving multiple pills, that's against the Florida Dental Code. Some dentists do that. That's not very safe because you never know when the effect's going to happen and when they're going to drop off, So they will get respiratory depression, and you do not have an emergency line in to reverse those effects. With oral, there is a lingering drowsiness. Patients may feel groggy for several hours, which can affect their ability to function normally. They obviously will need someone to drive them home. And another disadvantage is the risk of, like I said, over sedation. The response to the medication, everybody is different. Everybody is on different medications. Some people have different diseases, maybe liver disease or kidney disease, where it's going to affect different patients in different ways. So it needs to be monitored closely, and you do not want to multiple dose in this situation. It has also limited effects for moderate to severe anxiety. So patients that we see in our office, we do not do oral sedation. It's not going to be enough, once again, to get through the procedures or to do it in a standardized way where we can control safely their sedation. And it's also not suitable for all patients. The next level is IV dental sedation. And this is kind of in our wheelhouse. This is what we do on a daily basis, mainly due to the wonderful effects it has for patients and the safety level. So it is administered through a vein. So we do place an IV, but the needle is removed. So there's just a sheath that's in the vein that administers the medicament. So some patients that are afraid of needles, we can, pre-medicate them. Lots of times we will give them some juice with some medication in there that will relax them enough so that we can get the IV. With some of our special needs patients, there's other options. The juice, if they won't take it, there's nasal that we can give that will relax them very quickly and allow us to get that IV in. So the advantages of IV dental sedation is it is a deeper level of sedation than oral sedation. And the main advantage, which is so great, is we titrate it to effect. So the advantages of having access in a vein is you only want to give the amount of sedation that is necessary for that patient, because every patient is different. Every patient's on different medications, has different conditions, different weights. It's very important to titrate to effect. So only give that amount that's going to be not only safe, but effective, so they're not going to have any memory of the situation or the dental procedures, and they're going to be very comfortable. So the big advantage is it has rapid onset. So once the IV's in, literally within a minute, the patient is going to be sedated, and it's delivered directly into the bloodstream. This allows the patient to relax almost immediately. I mentioned also the adjustable sedation levels, so we're able to give the medications that are appropriate for those patients and adjust those levels in real time, ensuring that the patient stays comfortable and sedated through the length of the procedure. Whereas oral sedation, you don't know, how the patient's going to react through that procedure and how it's going to hit them. With IV dental sedation, we can monitor that. We have all the equipment, which we'll get into, which is great. So we can see if the patient's blood pressure or heart rate is raising, and that'll indicate whether we need to give a little bit more, or maybe our anesthetic isn't as effective. We might have to give a little bit more of that. So we're able to keep that patient very comfortable through that sedation. Also, like I mentioned, it's a deeper level of sedation than oral or nitrous oxide. We like to say, call it a dream visit, because the patient's going to come in, and it could be 5 minutes, it could be 4 hours. It's all the same to them because they're going to have a nice nap. It has an amnesic effect, so they're not going to remember the procedures or what was done. So they won't remember any shots in the mouth. They won't remember the extractions, root canals, implants, whatever may have been done that day. So once again, the amnesic effect, meaning they'll have no recollection of what was done. It's ideal for patients with dental phobias. And we'll get into the other patients that it works great for, like gaggers, special needs, dementia. It's also suitable for complex procedures. Some of the advantages of our offices is we have all the specialists on hand that are also sedation trained. So patients can have multiple procedures. They can have an oral surgeon there to place implants or remove wisdom teeth or biopsies or things of that sort. We have an endodontist, IV sedation endodontist on staff, who can do all the root canals if multiple root canals are needed, and the patient will have no recollection of this. It can all be done at the same time as crowns, fillings, deep cleanings. That's all done without the sensitivity or without the memory of it. It also minimizes the gag reflex. So a lot of patients are gaggers or can't handle the x-rays, or can't handle the impressions, or can't handle having all that water or hands in their mouth, or they're claustrophobic. This IV dental sedation works great for them. Some of the disadvantages. What are the disadvantages? It requires an IV. It requires a needle. We try to get around that by pre-medicating, or, like I said, giving them some juice to totally relax them. As soon as they start to fade off, we're able to put the IV in and then get the monitors on and get the sedation going. The patient recovery time could be a disadvantage or an advantage. So at the end of the procedure, obviously we stop dispensing the medication. So the patient's going to start to become more active, start to communicate with us. We use that as a great time to adjust their bite, adjust any temporaries, check everything, maybe place the fluoride at the end for a patient. And although they will be communicating with us, and we do a final assessment, it's called an Aldrate scale, to make sure that they are receptive enough to leave the office, that their oxygen level is high enough, that they can respond. We do certain tests, and the doctors have to sign off on that before we release the patient. And even though they're communicating with us, many of those patients won't remember those conversations because they still do have some medications in their system. And it's what we call a half-life, how long it takes for that to be released from their system. And in future podcasts, we'll get into that and what medications we use and which ones work best for which situations. But I actually think it's an advantage, the recovery time, because the patient can go home, take it easy. They're still numb, so they can get some soft foods in. They can take a a pain pill and just make it an excellent experience. Potential side effects, same thing, nausea, dizziness, possible vomiting. We, knock on wood, try to get around that. So for our patients, not only will we be having some medications on board for discomfort and for the amnesic effect, but also they'll have something on board for nausea, which common one is Zofran. They'll have something on board for swelling, and other medications can be needed. So the patient isn't going to have most of those lingering side effects. We try to avoid that. Nobody wants vomiting in the office or vomiting in the car on the way home or at home. It's not suitable for all patients, although most it is. It would be very limited few that it might not be, mostly medically compromised. And some of the other disadvantages might be the cost. Okay, so it does cost more than oral or nitrous sedation. I consider it a bargain just for the quality of life, and also because multiple procedures can be done at one time. We try to limit. The patient doesn't want to keep paying to be sedated. These patients do not like coming to the dental office. That's why they've avoided the dentist. So getting all these complex procedures done in one appointment and paying that fee is what I consider a very small portion of the treatment. Another disadvantage might be fasting. Patient needs to fast from fluids and foods 6 hours prior. That's why we start early. We do all our large sedations in the morning because of that fasting. We don't want the patients to have breakfast. We do want them to take most of their normal medications. We'll review that with a little bit of water, so they won't be so dehydrated, so that getting the IV is easier. But all those instructions are taken care of way ahead of time. So that's moderate IV dental sedation. We'll get into more patients and who that benefits a little later down the line. The next level of sedation would be the deeper general anesthesia. So a lot of general anesthesia where the patient is intubated either nasally or orally can be done in the hospital with an anesthesiologist, either medical or dental anesthesiologist. Can be done in a outpatient surgical center, which is common for a lot of pediatric patients that need an anesthesiologist. And some general anesthesia can be done in the dental office, such as oral surgery. So oral surgeons do have a general anesthesia permit. We do have an oral surgeon on staff, so we are allowed to do general anesthesia with the oral surgeon for those patients that require it. Some of the benefits of the sedation for general anesthesia, would be it's awesome for complex procedures or more invasive procedures. Obviously, impacted wisdom teeth, some of the larger implant cases or zygomatic implant cases, these might be beneficial to have general anesthesia. Some of the special needs that we can't handle with IV typical sedation, where they're more advanced special needs that should be handled by an anesthesiologist, would be a general anesthesia. So those type patients can be handled in surgical centers or the hospital. So what would be the disadvantages or cons of general anesthesia? Risks involved. So it's a higher risk value than moderate sedation. In our office, for our moderate sedation, IV dental sedation, we only use reversible drugs. So the medications that we're giving you, there is a reversal. We can give the reversal if there's ever an emergency or a need, and the patient will be back to baseline. It will negate the effects of the medications that we had given. With general anesthesia, some of those medications, the majority are not reversible. Some patients have had propofol, have had ketamine. These types of anesthetics or anesthesia medications are short-acting, although they do not have a reversal. The next disadvantage might be higher costs. If it's being done in a hospital, obviously, or a surgical center, there are numerous costs involved with that. In a general dental office that has a general anesthesia permit or an oral surgeon working there, the cost would be higher than mild or moderate IV dental sedation. It can be used for pre-existing conditions, patients with certain health conditions where they need to be intubated and treated. So, who do all these sedations benefit? In our office, the majority of the patients, we'll put this up on the screen. This is kind of our mind map that depicts all of the patients that can benefit from IV dental sedation. And like you see, we call it the dream visit. But first and foremost are those dental and needle phobics, the high anxiety patients. A lot of these patients avoid the dentist. They won't come in to a normal dental office unless they're in extreme pain or they break a front tooth or they're losing teeth due to periodontal disease. And at that point, it gets to a point where they've hit their tipping point and they need to come in. So dental phobics, needle phobics, very high anxiety or fearful patients. After COVID now, we see a much higher rate of anxiety. Some of the conditions that mental health issues that we've seen after COVID, a lot of patients have high anxiety for any kind of care. So this works great for those patients. They won't have any recollection. It'll be the best dental appointment they've ever had because they're not going to remember it. The next patient that benefits is those that have had past negative dental experiences. This is very typical. Patients that maybe were maybe anesthetized but fully awake when they had their wisdom teeth out. That can be very traumatic. Every patient has a story. They all come in saying, the patient was on my chest trying to get a tooth out, and that's all I remember, and I'm just totally petrified. Or when I was a child, they just held me down and did the dentistry. These patients are traumatized, and IV dental sedation works great for them. Another patient base that we see a lot of are the gaggers. So gaggers, like I mentioned previously, cannot have all this apparatus in their mouth. They cannot take impressions. You can't even get past their lips. You can't take dental x-rays, even though we're using the digital ones. So they need to be sedated. One of the factors that's so important with gaggers is what they don't realize is they avoid the dentist for so long, and then they come in and say, okay, I'm ready to have my teeth removed and I want dentures. A lot of these patients can't handle a denture. They can't even get it past their lips. They're gagging up, so they're not going to wear a denture. Or any appliance because they're such a gagger. So a lot of these patients, unfortunately, will either be toothless or they need to invest in implants if they have enough bone remaining at that point. Otherwise, we'll have to do extensive bone grafting for these patients. So gaggers are another demographic that IV dental sedation works really well for. A lot of patients we get referrals from other dentists involve patients that have sensitive teeth or can't get numb. So it's never a good situation either for the dentist in the office or for the patient if the tooth is not numb. If they can't get it numb or they have a hot tooth or it's infected or the patient says, all my teeth are sensitive, you numb me here, but I'm feeling it over here. These patients do wonderfully being sedated. They'll have no recollection. They're not going to feel that. And we're able to treat those patients very well. Another big group would be PTSD. So from many situations, a lot of these patients were in the service and might have had treatment without sedation, or they were in combat and just loud noises, or the handpiece sound. Some patients can't that are claustrophobic can't be in that situation of a small operatory. Other patients can't be surrounded by people or the noises or the monitors. These people work great for sedation. So PTSD patients, a lot of them have a very high anxiety rate, and they do need dental sedation to have their dentistry done. Other typical patients could be just those that have complex dental procedures or have time constraints where they want to have all their work done, but they want to have it done in limited appointments, 1 to 2 appointments. they don't want to come back and just have a quadrant at a time done and have 10 to 20 appointments over a period of months when they can have it done in 1 or 2 appointments being sedated. So that's a huge advantage for those type of patients that need extensive treatment. Another big group is the Alzheimer's or dementia patient, which kind of hits home for me. I have a family history of that. And these patients, whether they're being taken care of at home with a caregiver, whether they're in a assisted living or possibly memory care, we see a lot of these patients. They're not being serviced well. Some of them are combative, or they get combative. They don't allow their teeth to be brushed. And the oral cavity is the dirty surface of the body. There's more bacteria there than anywhere else. And this just starts to replicate and increase, causing numerous problems. Also, some of the medications that these patients are on causes them to grind their teeth, and they fracture teeth. They get numerous infections that they don't always know about. They're not feeling it or reacting to it. These patients are excellent patients once they're sedated. So once we have an IV in, they take very little to sedate them, and they become excellent patients. We recommend that we get them cleaned up. Obviously, these patients, we're not going to be placing removable prosthetics in their mouth. They're not going to wear mouth guards, dentures, partials. So the biggest key is to maintain their health and their function. If we can maintain some teeth so they can still masticate and function and be able to eat, and for them to have a healthy situation, because we don't want them swallowing all that infection. That's what our goals are for these patients. And one of the bigger groups that we see also are special needs patients. These are my favorite patients. They're the most gratifying patients to treat. A lot of them are very loving. We've been seeing them for numerous years. They come a long way because very few offices can sedate and treat these patients. A lot of the special needs were treated in a pedo office with an anesthesiologist, but once they age out of that, whether it be 16 or 18, nobody really out there is treating them. So this would involve, autism at different levels. We see a lot of Down syndrome, cerebral palsy, cognitive issues, both mental and physical disabilities. So these patients are great. Some of them are combative. Some of them are so fearful of any doctor or dentist that we have to use some techniques to get the IV. But we've been doing it, for quite a long time. And the other patients that we see that might not be as common, TMJ patients that might not be able to open or have pain in their joints, so they can't have a lot of dental work done. Patients that have limited opening. We see a lot of those. Nobody can get a handpiece in their mouth, and if they break a tooth or fracture a tooth, we're able to sedate them, give them some medications, that relax the muscles, give them something afterwards so they won't have any discomfort or swelling, and we're able to treat these patients very well. A few other odd patients, not odd, but odd situations in patients that we're able to treat. We do see patients that are allergic to anesthetics. So there is a group of patients out there allergic to anesthetics. They need to be sedated. We can use alternatives. There are some patients out there that are referred to us from, say, Tampa General that need transplants. These patients obviously are very medically compromised. However, they won't be put on the organ list, or they won't be able to get a bone marrow transplant unless all their infection is removed. So a lot of these patients will be sent to us because we're able to sedate them, do all their work in 1 or 2 appointments, and then I will see them typically 2 weeks later to evaluate, make sure there's no active infection, and then sign off so that they can be treated in the hospital. So obviously life or death situations there. So that's also very gratifying. So we have a very wide mix of patients that can be treated. I truly think it's just truly a dream visit. What are the benefits for these patients? Obviously comfort. We say wake up to a new smile. The amnesic effect, no recollection of the appointment or any of the work that was done. No need for the fear or the anxiety that they've had working out for many years prior to coming in. So once they've been treated by us, they understand what the process is. They understand they're not going to have any of that fear or discomfort later, and they become lifelong patients, actually missionaries for our practice. And another important thing is no judgment. A lot of these patients haven't seen a dentist in many years. They're embarrassed due to their fear. They've avoided the dentist, and they have a lot of breakdown. We call it a no judgment zone. Most patients say, "Oh, I'm sure it's the worst mouth you've seen." And I tell them it's not even the worst mouth we've seen this hour. We see many patients with many broken down dentitions that need our services because they've been avoiding it. It's all been due to fear, not because they didn't want to have their teeth treated. A lot of these patients have had dental insurance for numerous years and never utilized it, kept paying into the insurance industry without ever using the benefits. No embarrassment. We treat these patients with respect. They're very good patients for us, and hopefully we can change their lives and change their smiles. So hopefully I touch base on a few of the issues, a few of the benefits of sedation. I'm just, barely touching the surface. As we progress into the podcast, we'll go deeper. We'll peel away the onion a little bit and be able to hopefully answer a lot of your questions. As future episodes come, we will have guests. We will talk about all the equipment, all the safety concerns. We'll get into those, all the medications that we use for different situations, the specialists that we're able to use. So that's all to come. We have many patients that drive many hours to come see us. We want to assure you that in most situations we'll be able to treat you. So as a special treat or a special gift for hanging out this long, listening to me, if you want to reach us at any point, you can check out our website at happydentistry.com. We do have sedation videos there. We have more information there. And you can also sign up, and I will send you a free copy of my third book, my newest book, The Dental Fear Solution, A Patient's Guide to IV Dental Sedation. This goes into most of the frequently asked questions, a lot of things that when patients are in the office, they forget or they're too nervous to. So you can get your copy ahead of time. You can watch the video ahead of time, or you can make that call. The call is 813-DENTIST, and we'll be happy to get you an appointment and see you in one of our locations. So we currently have 12 locations, all on the west coast of Florida, from Spring Hill, Florida, all the way down south to our newest office in Lakewood Ranch, which is more in the Bradenton, Sarasota area, and all the farthest east to, at this point, Plant City. So in between, we have 12 offices all around the suburbs outside of Tampa, Hudson, Tarpon, Newport Richey, Dunedin, numerous offices, St. Pete. So I'm sure we have an office close to you or one coming close to you. So our next office has been purchased. We are designing plans, and we will be in the Carrollwood area the coming year. So thank you again for listening. Until later, keep smiling.